Hi, welcome to the another edition of our EuroHealth podcast, shot in Prague with a very interesting guest. My name is Ms Schiffer. I'm the moderator. My colleague Jan Klusáček is going to present the next episode, and I'm glad we can welcome Ms Katrin Schiffer today. She is, I'll have a long bio, but I'll try to shorten it. She studied social work in Germany and moved to the Netherlands in 1994. Since then, she has worked in several organizations and projects targeting drug users and sex workers. And since 1996, Katrin works for the Rainbow Group, a low-threshold organization targeting drug users, homeless people, and people with mental health problems. And she is one of the coordinators of Correlation Europe Harm Reduction Network with more than 250 members in all European countries. Is that it?
Wonderful summary. Nothing else to say.
Okay. So what brought you to Prague?
Yeah, what brought us to Prague, or me to Prague? We are organizing currently as Correlation together with a number of partners, European partners, the European Harm Reduction Conference 2021, a conference which we actually wanted to organize already last year, but COVID made it impossible. So I think we shifted the date 4 times. So now we did it, and at the end it was still very unclear because now numbers are increasing again, and we were really becoming very nervous. But here we are, and we have today we kicked off the conference with some pre-conference sessions in the morning, and at 2:30 we had the opening sessions with a full room, and we have around 440 people participating from, I think, 35 or 40 countries, European countries, and everyone is so happy and so enthusiastic to be there again. And you really feel the vibes. People are
finally meeting.
Yes, after 2 years. I mean, it's really like there was so much enthusiasm and so much positive energy in the room. That's really great.
Yeah. Do you feel that people are finally, because there's a lot of talk that COVID changed the way we meet and talk, and then all the conferences will be held online. Do you feel it's not true? It's because I really feel it. I feel that there is a lot of things that make sense to do online.
Definitely.
But like certain amount of talking and brainstorming and like a lot of exchange of ideas, it just cannot be done that way.
It's true. It's definitely changed a lot, and I think it will remain that way, that we will organize more meetings, more exchange in an online way. I mean, we already did that as a European network.
Yeah.
You cannot meet all the time face to face. But I think what we saw now is probably that we could shift at least half of the meetings into online calls and meetings, and not necessarily meeting for 2 days, but to have shorter calls for very specific issues. But what we also saw is that, meetings became more effective, more efficient. You focus on a specific issue, but what you miss is all the things in between. So it's not only giving a presentation or addressing a certain issue, but it's also the things you do next to that. You meet in the corridor, you have lunch together, you have dinner, you drink a beer, and there is actually where you plan new projects, when you organize new ways of cooperation. And this is definitely what I felt today also, that people are tired of only having efficient meetings. And there is you really feel there is inspiration needed, and you don't get inspiration through online meetings only. That's, I think, but again, I think definitely it will change. Also, once COVID is over, there is no need to do everything through face-to-face meetings.
Okay, so what are your major goals and challenges for the conference?
So next to the fact that we really wanted to have a meeting again with the harm reduction family in Europe, it was we had a motto, or we have a motto. It's called Harm Reduction at Work, Innovation, community and political leadership. And I think what we wanted to show at that point is, okay, we know that harm reduction works. We know that there is a lot of evidence that harm reduction interventions are effective. And it is now time to scale up harm reduction services throughout Europe, to increase availability, to increase access to services. And for sure, we also need to collect more evidence, and we need to do more scientific research. But that is not a reason to wait for implementations. And we also want political leadership. We want that governments take their responsibility and invest in harm reduction, not only in words, but also in money and in resources. And we... what is an important thing, we think the communities, this is the harm reduction community, including people who use drugs, social workers in the harm reduction field, but also researchers. There is the knowledge and there is the experience, and we feel that politicians need to listen more to civil society and to peers and people who use drugs where the knowledge is. So it's not only about evidence or scientific evidence. It's also about practical evidence, and it's about lived experience of people who use drugs. Because there is a lot of knowledge, and I think this is very often not seen. People who use drugs are seen as a problem or as a part of the problem, but not as a part of the solution, which has proven to be wrong, because we know that many interventions were actually initiated and started by peers.
Yeah. So what kind of major change, or do you see some kind of major shift in thinking in Europe about harm reduction and the whole approach to drug issues?
Yeah, I think it becomes more and more hard to for people to be against harm reduction, because we all know it's efficient, it's effective, it works, it's cost effective. It's more than only interventions. It is something where we see that the current model, where people are criminalized for using drugs, more and more governments realize that this is not working. And while, for example, when you look to drug demand reduction and organizations working in the field of harm reduction constantly being asked, prove that it is working, prove that it is working, I wonder why people never ask, is the whole system, which is based on crime prevention and drug policy control, we all know it's not working.
Yeah.
People will always use drugs if you like it or not. And I think we should let go the idea of a drug-free world, because we know it's not something which will happen. I am not even sure if I would like to have a drug-free world, but even if I would like it, many other people wouldn't like it as well. And it's probably more about looking for ways that people can do it in the most safe way for themselves, and also for the people who are close to them, and for society in general. And this is a kind of pragmatic approach where I think more and more countries in Europe, but also outside of Europe, are realizing that this is an approach, and that decriminalization or even regulation of drugs are needed.
I saw this shift when I read. There was a book, and I don't remember the title, but it was written by a collective of authors. One of them was, surprisingly for me, Richard Branson. Mm-hmm. The other one was Cesar Gaviria, who was the former Colombian prime minister, I think, or president. We had Pavel Bem there, who was like a former mayor of
It's a global drug policy
it was basically, it was like a very loud shout saying like, end the war, it's time to end the war on drugs, because it's costing a lot of money, and at the end and lives, and at the end you're getting nowhere. And I think in its few years since they wrote it, and then you see all the shifts globally, and with the U.S. Moving in many states of the United States to decriminalization or even full legalization. And so I thought, and my interest is specifically in Europe, when your networks is monitoring this kind of stuff. Do you see that shift, or do you see both tendencies?
Yeah, we see both tendencies. So we see, we do not focus only on the European Union. So if we look, but you could probably make a distinction between these two regions. So we see in countries like the Netherlands, Germany, the UK, where actually harm reduction has a long-standing tradition, and which were actually the countries where it has been firstly implemented, that you could say, okay, there is not a lot. There's not an ongoing discussion on why do we need to do that. Also, we also see that some politicians, because probably in the Netherlands drug use has changed. So the typical group of people who use drugs has changed. So from the heroin users, injecting drug use, which were living on the streets, having really lots of problems, health problems. They are still there, but they're becoming less and less. While there is coming a new group of people, and these are younger people, not necessarily having problems with drug use or not being addicted, or so. What I see with that somehow the memory of how it was and how important harm reduction still is for the older group, that it is also an intervention which works for the newer group. And that some people want to somehow, probably because the group is younger, or that the moral idea, and this is what constantly is what people just keep in their genes probably. Drug use is not good. We don't want it. And if people are younger, it's getting even worse, because then they think we need to protect our children because it's not normal to use drugs. Yes, it is, because it has always been like that.
Yeah.
And again, I mean, probably the fight against heroin and cocaine has probably caused all these new, that there are so many new drugs outside, which have so much more, which are so much more dangerous. So yes, there is an overall increasing acceptance of harm reduction, but what we also see, there is also in many countries, like take the Balkan area, take Romania, Bulgaria, Bosnia-Herzegovina. When you look to these countries, harm reduction services are nearly closed down because there is no funding. This applies also to all, when you look to Russia or to the eastern part. So what you see is there is not only a funding crisis, but there is a political resistance in many governments. If you talk about Russia, if you talk about Hungary, for example, there is a political resistance. Some countries do have structural problems, like Bosnia-Herzegovina. There is, in principle, there is not a political unwill, but somehow the structures are so difficult that it is very, that the money doesn't arrive there where it should be.
Okay.
And then you have just countries who don't give a shit, probably. And where you can see that after the Global Fund has withdrawn from the region, and other funders like Open Society, there for a while there were probably some needle exchange programs, but now they are not there anymore, or probably only in one country. And this is what you might see when you look to the EMCDDA reporting, that, for example, where countries indicate is there needle exchange programs, there might be a needle exchange program. But if there is a needle exchange program only in one city, it is very difficult to talk about that the needle exchange programs are there. So what we actually need to do is also look to the quality and overall availability. There are lots of rural areas which are not at all having any kind of harm reduction services, or like Romania, I think there is only there was even the problem that people couldn't get their treatment for HIV/AIDS. So I mean, this is something. These are basic treatment and harm reduction services which need to be ensured. I'm not even talking about more advanced harm reduction interventions like drug consumption rooms or naloxone distribution. I'm talking about the basic ones.
Okay. And do you think that the shift I see in public discourse is now driven by something that surprises me, but in a lot of, I would say, pop culture and maybe in the podcast scene globally, and with Joe Rogan and his podcast, he's openly talking about basically enhancing performance and with microdosing of psychedelics and like a lot of these new trends that somehow are maybe not in the mainstream media that much, but it's people really talk about them and suddenly see not only the view that I was told as a kid in the 90s that you take a joint and then 2 weeks later you're hooked on heroin and you're done. So does this play a role in more in like public discourse that people maybe realize, okay, it's more difficult than just this little topic that we see?
Yeah, I think it's what I meant before. It's getting that people think we cannot let drugs become a normal thing. And for sure, I can understand. I mean, if my kid would start using drugs extensively, I would be worried as well, for sure.
Yeah.
I think that's not that's not a basis for good policies and good interventions as well. Yeah. I think the fact is, I believe that drugs always have been there. I mean, there was probably from when we talk about heroin, it was very many people used heroin at that time, or cocaine. Cocaine is for a long time, it's a very normal drug.
Yeah.
I mean, when I came to Amsterdam, everyone was using cocaine. Not everyone. No, but when you went to the bar, people were using or speed or cocaine or the balloons with, and it's somehow or ecstasy.
Yeah. So I was surprised when I read the basically, again, I don't remember the title of the book, but it was about drug consumption before and during Third Reich, like 20s, 30s, and it was massive. With what was the main one that, and it was like funny editorial in a newspaper selling this. I think it's basically speed. We call it pervitin in the Czech.
They
like
did kind of cocktails.
Yeah.
It's a cocktail
for Hitler.
Yeah,
he was like hooked on that.
Yeah. So speed and some. So talking about an increase of, or that things are becoming normal. I think drug use somehow has always been normal. What is weird for us now that we do not understand, for the older generation, is that probably we are not able to follow anymore what is actually being used. Yeah. And that, before it was heroin or cocaine or it was ecstasy and alcohol or cigarettes or whatever. But now it is so much broader, and you wouldn't know what the risks are and the harms are, and that's the problem. Yeah. I think it wouldn't. I think it doesn't help to come with a moral discussion about we shouldn't make it normal, because for the young people it is normal. Yeah. So the fact is, or the important thing is, how do we need to respond to that?
Yeah, and I think it's funny in Czech context because we are the country with the highest consumption of beer per capita, with the widespread alcohol consumption and smoking. So really the distinction between fully legal and encouraged drugs and drugs that they're not really that different from these is just so. Just so crazy, and there is a growing public concern about judges sending, older people to prison for growing few cannabis plants to cure, to put like a lotion for some disease or something like that. So it's just ridiculous.
Yeah, it is, and I think, this is what we see, that alcohol is in the discussion. There is a Bavarian, the drug coordinator from Germany, for example. So I'm still very much into the German drug policy field, somehow connected. She's a strong advocating for. She's not a friend of cannabis.
Okay.
So. And there were a lot of arguments towards her made. Listen, why do we not think about a more not even legalization, but a more open, tolerant approach towards cannabis, while alcohol is proven.
Yeah.
When we talk about evidence-based interventions, well, it is proven that alcohol is so much more dangerous.
Yeah.
And actually, there are user rooms in Bavaria, big, every day, people drinking beer.
Yeah.
I mean, when you go to in the morning to pick up your bread, there people are drinking beer. Yeah. Big normal people. It's very normal.
Yeah. Here too. That's a very common characteristic, but of Czech Republic and Germany. But how do you see, as somebody who you worked your way up basically from the like local community work to this like coordination role European wide? How do you see the two areas, which is one is basically European wide, with I guess the European Commission trying to do something with some of ambitious plans, and then each of the nation states. Is there a tension? Is there a possibility, but is there some kind of progress that you see in the area, or is it still, that there's some plan, a thought on the big level, but like then everybody does it how they feel fit?
It's interesting because we just had a kind of Slido discussion in the opening session of the conference about what do you think is the influence, or does the EU can the EU influence national drug policy? Mm-hmm. And actually, I don't remember, but it was about 60% said yes, they somehow, or 70% somehow can influence national drug policy. So that was a quite positive. Somehow what, huh?
Yeah.
so and for sure we also I'm also part of the Civil Society Forum on Drugs. So this is the civil society group which advises also the European Commission on drug policy issues. And in that forum, what we did is that we said, okay, we actually need to use the EU drug strategy and the EU drug action plan also at Advocacy too for organizations to advocate for better national drug policies. And we did different, so with the previous strategy and action plan, we did case studies in different countries that they picked a certain priority in the action plan and really tried to use that for an advocacy activity. And I think, yes, also, I mean, member states are independent, and the EU can never ever say to the member states, you need to do that. Yeah. But what we as civil society can say is that you committed yourself as, I mean, the EU drug strategy is something which is adopted by all member states. Yeah. So for sure we can go to the member states and say you committed yourself to these priorities, and can we have a talk how to implement these different priorities and actions, which seemed so wonderful to you that you prepared a document of I don't know how many pages. And again, that's interesting that civil society organizations, when they implement projects or actions, are always asked to monitor and evaluate each of their, and they need to prove what is the impact of actions and develop indicators so it can be measured. actually the EU drug strategy and action plan, as good as it is now, the new one, there.
You mean the beating cancer plan, or
no? EU drug strategy
okay.
and the EU drug action plan, which is developed by the in this case by the Council of the EU, and which is actually adopted by the member states. There are not many indicators, so at the end it is very difficult to say is this action plan successfully implemented, because if you don't have measurable indicators, it is very difficult to do so. I mean, each application from a civil society organization would not be accepted like that, because we would be sent home and say, do it over and come up with some measurable indicators so we can say what you really want to reach. I mean, saying we want to scale up harm reduction interventions, it's a nice goal, but what is scaling up? What does that mean? From when?
But is there like a general agreement on quality standards for harm reduction across Europe?
The strategy?
Yeah.
No,
if that contains them, or is there in like your organization or the, let's say, NGO sector, like a consensus on quality standards?
But that's a different discussion, because I mean there are different quality standards which have already been developed in previous EU projects, and there is currently a project in an EU project where we are part of. That's called Phoenix, and there we look in how far are quality standards in drug demand reduction. Which do we have? Standards and also guidelines, which are much more specific. And how are they implemented in the different member states? And that's a difficult, again, this is also difficult to measure. Do we have them? Are they implemented? And when we look to countries like, again, Romania, talking about quality standards when you don't even have
the basic
access and availability to harm reduction services like needle exchange, it's very hard to say, let's talk about quality standards, but again, I think we need to do that for sure. Quality standards are important, but measuring and monitoring implementation of quality standards is also important. And talking about the action plan again, the EU drug strategy and action plan, there we also need to see in how far do member states actually implement the great plans they have. And I mean, as part of the Civil Society Forum, we have been doing, or we are currently looking in how far have they been implemented with the previous action plan. And for sure, this is for some countries, that's not a very nice idea, especially if civil society is doing a checklist and saying, no, you're not doing that, you're not doing that, you're not doing that.
Yeah, that makes sense. But isn't there even in European institutions, because as I was mentioning the beating cancer plan, one of I saw a discussion about it, and there was like a very good point that said that part of it is the idea of basically eradicating vices, like a zero tolerance approach in the cancer section, because that involved as well like smoking and all these things. So isn't there kind of as well difference on the topic in Europe?
I mean the EU, I know that the cancer plan it's a huge thing in the EU for Health program, which is just released this year. So it's and they're totally acceptable because cancer is a huge problem. And if you look to cancer, for sure, not using drugs, not smoking, would be a wise decision. But that's how things work. I mean, we drive cars, we go we fly to different places. I mean, looking to the climate change, there is so much more than only smoking, using drugs, drinking alcohol, which makes it, which are unhealthy. I'm not saying that we should promote smoking, drinking alcohol or drugs, but I mean, what for me, the cancer approach is not necessarily linked to the drug policy issue. And And for sure, we could say probably there needs to come a kind of combined thing, because when we talk about, for example, that a large group of people who use drugs or who inject drugs have hepatitis C, which in the long term can lead to liver cancer, there is definitely a link. We also know that marginalized and vulnerable groups do have an increased risk for all kind of health problems and risks. So for sure, I would think it is a wise decision to focus on marginalized and vulnerable groups in general.
Yeah.
The question is in how far this will happen. I don't, because cancer is such a big problem that the marginalized groups probably will come, as always, at the very end.
Yeah, yeah. And what do you think about, or you see as the biggest challenges, or maybe steps that need to be taken, probably on a European level, to really put harm reduction on the as the dominant strategy?
What probably in first instance need to happen, you did have an EU program, the Justice Program, Drug Policy Initiative Program, which is unfortunately finalized and will not be continued at the moment. In this program, civil society organizations and also other organizations were able to ask to get funding for specific projects in the field of drug policy. This was the only program where specifically drug policy and drug-related issues were supported. This program will end. There will be a continuation of in the Internal Security Fund, which will focus, as you can already hear, it will focus on crime prevention and security-oriented issues. So probably there is a chance for civil society organizations to somehow include topics. But what we strongly have advocated for, not only Correlation but also other organizations, is that drugs are coming into the new EU for Health program and not under the heading of the beating cancer plan, because drug policy is too essential to come under one heading and it is too specific. So we have there is happily in the current work program for 21, there is a call specifically for civil society organization focusing on communicable diseases, HIV/AIDS, hepatitis C, specifically referring to harm reduction. That's great. But we also want to have that in the follow-up programs, because we believe it's important to address drug policy, and it is definitely something which belongs to health.
Yeah, yeah.
So, and now, I think the advocacy efforts were somehow effective, because also drugs will not necessarily be included in a 22 program because that's too late. It might come in the 23 program, and there are some countries which have been very supportive in that and really pushed also for that, because as you can imagine, civil society might be annoying in terms of constantly asking that, but if there are no member states which support that and also members of the parliament, it will not be effective.
Okay. That leads me to two questions. One is, do you think there will be there's a chance for a unified approach across all these programs? Because with the discussion I'm referring to about beating cancer plan, there was a very visibly different treatment of other addictions like tobacco and others than probably in the drug strategy. So do you see a space for data-based approach across all these platforms?
Yeah.
And do we have reliable scientific backed data that are sufficient for this?
I feel a bit that I don't want really to go too deep in that, because I really don't have the expertise when it comes to tobacco and alcohol. What I really believe is, again, when you look to the problem from the perspective from cancer, you definitely need to say, okay, it's bad to do it, and if all people would stop smoking, and would stop drinking alcohol and do all the other things not
advisable.
That would be great.
Yeah.
But also,
happen.
it's probably not effective. And I think harm reduction in some countries, and that's probably the ideological problem, that still people believe it's not good to use drugs. We should not use drugs because it's not good. It's a moral approach, and it's not good to be addicted. But people are addicted to many things, and probably most of the people who use drugs are not addicted. They're just using it sometimes, just as we sometimes drink a beer or more on one evening. But the point is that people fear certain problems, and I'm not sure, again, in how far. I think the cancer. I'm somehow lost in that.
That's the both of us.
So it's probably because I'm not in the field of tobacco, and that I think probably tobacco. I used to smoke.
Yeah.
And I'm deep in my heart, I'm a smoker.
Congratulations for stopping.
And I still feel how strong the
addiction is.
The addiction and the need is, because it's such a nice thing. So if I would be able to do it sometimes, I would definitely do it. But I know that I'm someone, if I do something, I'm doing it good, and that would mean that I would smoke a lot. So personally, I still believe there are many people proving that tobacco can be used in a controlled way. And probably the whole idea, but also with alcohol and the whole treatment, the abstinence-based treatment industry, let's say, is very much based that they say, okay, once you are an alcoholic, you will always be an alcoholic. And personally, I think, I don't know, I doubt it, because I know many people who smoked and started to smoke sometimes or in a controlled way. And there are also many people drinking alcohol in a controlled way. And probably that's not up to the standards, to the moral standards of many people.
Yeah.
But who are we?
To judge, To
judge. I mean, people are hurting themselves, and we don't talk about all the people eating too much, or eating too fat, or not doing any kind of sports, or.
No, isn't that maybe a little diversion? But isn't that fascinating about the whole COVID debate? Because I really think it shrinks the whole debate on vaccines. Basically, and if you take the overall general health of the population on how do you move, how you eat, so that somehow it's just non-existent in the public discussion.
For now, it's not.
For now, So I, related to drugs, I really think it's basically a little bit of the same discussion. That this is like. Off the table, how people treat themselves, and then it's like focused on basically, the drugs without any other context. Okay, and so in Europe, where do you politically see, from your perspective and perspective of harm reduction approaches, like the role model?
The wrong model?
Yeah.
In Europe?
Whether there is. Or maybe globally, but like Europe is...
I see the wrong model in countries where I can see that there is a strong populist or right-wing government. I mean, I can't say that now.
Yeah.
I'm talking for myself now only.
Yeah.
But that I see that civil society organizations are pushed outside. The space for civil society to say things is really restricted. I mean, you can see that in Poland, you can see that in Hungary. That's a very threatening.
But that's a bad model for you.
Yeah, that.
No, I was asking like a positive role.
You wanted a good one.
Role model, like who is the?
That's why I was already. You want a bad model? Okay, no, you want a good model.
Yeah,
okay.
Yeah.
If you look to a good model, I mean, I could say the Netherlands, but probably the Netherlands. Yeah, we have a very pragmatic approach, but probably sometimes too pragmatic, not with we are already so professionalized that things sometimes.
I think it's like hard to swallow for other Europeans sometimes.
It's not so hard to
No?
swallow anymore because I think most of countries have followed. I mean,
Yeah.
Germany has passed the Netherlands already in many
Okay.
ways. So it's I'm not probably except the cannabis experiment, but now Luxembourg is also doing things. So
Yeah.
I think Portugal has decriminalized drugs, and I think this is a good model, and it is a good model. What is a good model? I would say a good model is when you do when together with civil society, with the communities affected, meaning people who use drugs, you develop common policies, or it's a co-production. And I think this is happening more and more in the good countries, not in the
Okay.
bad ones. But in the good countries, there you see that, probably also because it has become a kind of, you cannot not work anymore together with civil society, at least officially.
Yeah.
But there are really models where this is now being implemented, and where civil society is no longer seen as an annoying little group of people who are constantly saying yes, but they are really seen as as people who can really contribute because they have the knowledge. I mean,
Okay.
if politicians or policymakers want to know something about what is going on in the reality, they always come to organizations. The EMCDDA focal points rely on the input of civil society organizations. So it is not unlogical to include civil society in the development of policies.
Do you talk a lot to MEPs?
Sometimes we talk to MEPs, and I mean, we when we advocated, for example, for the inclusion of civil society funding in the EU for Health program, we involved, or we approached MEPs when we organized certain drug policy meetings. We involved certain MEPs.
Because I was imagining it would be hard, because when you come from basically local background, that and you feel politicians at a place, be it a city or a state, have usually are very sensitive about topics that matter to people, and they see a situation in the city and in that part of a city, and even related to drugs and all the context it brings. But on a European level, isn't it a little bit detached? Because I mean, these people really have to talk in more abstract terms, and solutions that should fit all really different states.
I wouldn't say, because normally when we do this kind of advocacy, I would approach an MEP coming from the Netherlands or from Germany, and you shouldn't forget. I mean, politicians are still attached to their country, and they're somehow still representing interests coming from the country, and for sure from the party they belong to. But I don't think that MEPs are detached from reality. I probably see that there are less, that they probably have more freedom to think from a more helicopter view, because they are not forced from all the small things, I think people in the country feel that they are detached from what is happening in Europe.
And what from your point of view, maybe towards MEPs, would be your advice to what to push in the area of harm reduction, so it's more and more feasible?
Listen to the experts in the field, and not necessarily go now every week to a meeting in the country where they come from, but really, if you talk about drug policy, talk to people who use drugs, and talk to civil society organizations. And listen not only to policy makers, because very often policymakers do not have actually most of the time, and which is logical, because how can you know about some things if you don't come from the field. I don't know exactly what is going on in a DCR. I mean, my organization is running DCRs, but I would ask my colleague if I need to know something.
And do you think on European level that if you really want to push evidence-based, science-based solutions, is there a lot of, I understand there's a lot of experience coming from the NGO sector, but is there like authority on like scientifically evaluating the whole problematic and basically spitting out data that would be relevant and like good stuff to build upon on a European level?
Yeah, I mean, first of all, there is the EMCDDA. I think that's a wonderful agency and a very good institute, which really provides lots of data and evidence. But we also have, I mean, Correlation has developed a civil society monitoring tool, which we implement now for the third time, and we have also focal points in all EU, no, not in all EU, in all European countries nearly, I think 35 countries, where we collect information on specific drug-related issues, hepatitis C, overdose prevention, COVID-19, new drug trends. And then again, it's not about repeating the things which the EMCDDA is collecting, because they have much more resources and why to do something which is being done already. But we are looking from different perspectives and really looking into what is happening, what do we see. And this has become quite an important tool. And it is not what sometimes is being thought. Civil society monitoring or research is not bad quality research because it comes from, I mean, these are real researchers doing it.
Yeah.
And they also train people from practice to collect data in a good way. So I think that's probably an important one, that not only civil society can also collect data. And people who use drugs can collect data and do. I mean, there are so many participatory research actions which are very powerful, also when it comes to advocacy.
Okay. We always tend to finish in a positive manner, an optimistic manner. So what is your optimistic outlook on, after your conference and your remarks there, is the things that can really happen in foreseeable future for harm reduction on a European level?
Yeah, I think there are many. I want to close in a positive way. No, there are many positive things. So I think what I felt today when we had the opening session, there was a lot of power, there was a lot of energy. And I think as a harm reduction community, we can really move a lot of things forward. And we did. We did have some really advocacy successes this year. And we see that we are becoming a partner for many governments, a partner for the European Union or Commission, and a partner of the EMCDDA. And I think this is something we can be proud of and which we will continue. So I think
that's good. Okay, so thank you for coming to our podcast and to Prague. And we wish you a lot of luck with the conference still going and your future endeavors.
Thanks a lot. It was a pleasure being here.
Thank you.
Thanks.